A typical response to experiencing back pain is to take it easy, either staying in bed or at the very least, stopping any strenuous activities. While this approach is understandable and may even be recommended in the short term, when done for more than a day or two, it can actually undermine healing. Dr. Jeffrey Glover of Glover Chiropractic says lower back pain is one of the most common reasons he sees patients.
One of the biggest things that helps men in that practice is we tend to, just as a force of habit, carry our wallets in our back pocket. That's actually bad. What happens whenever we do that, we're actually sitting on our wallet, and as we sit on it, it's actually raising our pelvis up on one side, causing some abnormalities. It's fine to walk around with it in your back pocket, but as soon as you sit down, you want to take it out and put it in your front pocket. It'll relieve a lot of stress on your sacroiliac joint and your lumbar spine in general. Sleeping is another thing for men. Whenever they sleep, there's a couple ways you want to sleep to put your back in the best position to be comfortable. Sleeping on your side with a pillow between your knees takes a lot of pressure off the disc and the facet joints in your low back. If someone can't sleep on their side, sleeping on their back with a pillow underneath their knees is the number 2 way they can sleep. You want to avoid sleeping on your stomach. It puts your body at a real disadvantage and cramps up a lot of muscles. One of the big treatments that helps people prevent going into surgery is our spinal decompression therapy that we have. Basically, that works on degenerative discs, bulging discs, spinal stenosis. You'll notice that when they're in a grocery store, they'll have to put a lot of their weight on their cart when they're walking around because they have a bad disc. Now, a disc is the structure between each one of your vertebrae. That's the shock absorber of your spine. And once those start to deteriorate, it puts pressure on your spinal nerves. And that affects how long you can stand up and walk. Now, the decompression table itself actually helps to rehydrate those discs. So it basically makes the holes where the nerves go through bigger. Being in a heavy retirement community, we want to make sure people can take care of themselves. So we want to keep them self-reliant as long as possible. And the spinal decompression therapy is one of the ways we can really do that.
Dr. Glover adds that active forms of back exercises are almost always necessary to rehabilitate the spine and help alleviate back pain. You'll find links to appropriate back exercises, as well as contact information for Glover Chiropractic in Leesburg when you click the lower back pain story link icon on our homepage, yourhometownhealth.com.